Good morning. Welcome to GYN Corner. This is Dr. McDaniel. I'm an obstetrician gynecologist in New York City, Midtown Manhattan, west of the Empire State Building, and just 1 to 2 blocks around the corner from Madison Square Garden, Macy's, and Penn Station. Thank you for joining me here at GYN Corner. It's all things health related for women. I'm at the horse farm today. That's the little fountain at the horse farm. I'll be speaking about the treatment of ectopic pregnancy. I'm going to divvy this up into 2 or 3 sessions. So, to do a brief recap of the last two presentations, ectopic pregnancy is any pregnancy that occurs outside of the uterus, where obviously it's supposed to occur. Ectopic pregnancies arise because everyone who gets pregnant in the fallopian tubes, and then that fertilized egg is supposed to slowly work its way down through the fallopian tubes into the uterus, and then latch on into the uterine wall around 4 to 5 weeks of pregnancy. If that pregnancy is not in its proper location at 4 to 5 weeks, it will be an ectopic pregnancy. Ectopic pregnancies obviously can be dangerous because wherever they're located, they're going to grow. And when they grow, they're going to burst or rupture through the location where they're at. And wherever they are located, they're going to end up destroying that location. They're going to bleed out and they're going to potentially cause mortality. The mother's going to die. So if that pregnancy occurs in the cervix, say it gets all the way into the uterus, it drops through, lands on the cervix, we call that a cervical pregnancy. If it gets stuck in the fallopian tubes, it's a tubal pregnancy. And if it falls out of the fallopian tubes somewhere in the abdomen, it's an abdominal pregnancy. And I spoke yesterday about how I'd seen a woman who was 7 months pregnant, 28 to 29 weeks. She had an abdominal pregnancy. The pregnancy landed on the fatty apron overlying her intestines, and the placenta was adhered with an enormous blood supply to her omentum and her small intestines. They were both saved, but the tricky part was not the baby because the baby was perfectly fine. It was the mother with all of that abnormal blood supply from the placenta. So, the most important aspect of treating an ectopic pregnancy is first identifying it. So, once someone is pregnant, as soon as they find out they're pregnant, they do a home pregnancy test. The best thing to do is to go to their gynecologist and get their blood work done. That blood work always includes a blood pregnancy test. And that hormone it doesn't give us an exact age for the pregnancy, but it gives us a ballpark of how far along that pregnancy should be. If that hormone number is abnormally low for how far along she should be, then we will always repeat should always repeat that hormone in 2 to 3 days, because the hormone should be at least doubled every 2 to 3 days. If it's not, that's already indicative of a problem with the pregnancy. We'll usually repeat it a second time in 2 to 3 days to see if it's actually maybe just a little laggy, and see if in another 2 to 3 days it's doubled. If it hasn't, that's a huge problem. We'll do an ultrasound or sonogram to see if we can locate the pregnancy. If that hormone number is around 1200, we should be able to see that pregnancy on the ultrasound. Usually, if it's 5 weeks, well, I should say always, if it's 5 weeks of pregnancy, if the pregnancy should be 5 weeks, then we should see a little ball of water. That's the very early bag of water, amniotic sac. We call that a gestational sac. That gestational sac is all we should see at 5 weeks. If she's 6 weeks, we should see that sac with a tiny little gold bar, tiny little pole. That's the early fetus, that's the embryo, the early baby. We call that a fetal pole. And if she's 6.5 weeks, we should see the fetal pole along inside the little bag of water, the gestational sac, along with a heart beating. So we should be able to see the heart beating at 6.5 weeks. If someone's hormones are above 1200, especially if they're 1500 or higher, that pregnancy HCG, and we don't see anything at all in the uterus, we don't see anything in the pelvis, we say it's an ectopic of unknown origin. Oftentimes, we will be able to locate that gestational sac between 5 and 6 weeks, and that will tell us where the location is. If the pregnancy is not identified in the pelvis, then the ultrasound should include the abdominal cavity and specifically look very closely on the cervix to see if those are one of the potential locations of that abnormal pregnancy. Once the pregnancy has been confirmed or identified that it's an ectopic, then the most important is to discuss with the patient what the management or treatment will be. So the most important aspect of treating an ectopic is identifying it early, and then once it's identified early, the second part is to discuss with the patient how she's going to be managed for it. To do that, I'll come back at the next presentation and discuss the exact options for treatment. So the first step in treatment is confirming that the pregnancy is really outside of the uterus. That's with blood work, the HCG, and with the ultrasound of the sonogram, confirming the blood work numbers are not rising appropriately. They're not doubling every 2 to 3 days in the number. And then it's confirming that that hormone number is a high enough number where we should be able to see it on the uterus. We should be able to see the pregnancy on the ultrasound in the uterus, and then confirming that the location is not in the uterus, and potentially confirming exactly where it is located, and the presentation. If it's just a sac, if we can see a heartbeat, if there's fluid or potentially blood around it, those aspects. So that's today's presentation. It's the identification is the first step in the treatment of an ectopic pregnancy. This is Dr. McDaniel at GYN Corner, all things health related for women. Thank you very much for joining me. Please click that like button. Please click that subscribe, follow button here on the Facebook page. And please check out the YouTube page. Like, comment, subscribe. And you can also follow us on our podcast, GYN Corner. We're on Spotify, Anchor, and on Apple iTunes. Have a great rest of your weekend. Bye.